CataractCoach.com, resident case number 100 analysis. Please help us. What are your suggestions for this beginner surgeon? Anonymous resident operating here. Let's take a look. Good draping, by the way. All the lashes out of the way. Lid margin sequestered. Incision looks pretty reasonable. And let's see, maybe now a side port with that same blade. Okay, I'll take it. I like how you nick the limbal vessels. Let's see what it's going to do next here. Viscoelastic in the eye. Maybe, looks like that's HPMC for sure. Hydroxypropyl methylcellulose. That's a very dispersive viscoelastic. Not going to have good retention during the case, but it's very easy to use. Now, cystotome going in. Let's get the rexes done. And then there you go. We've sped the video up, so don't worry about that. We just want to get this case in an efficient manner. And let's see the rexes. This is always a good sign. If the rexes is good at case 100, I'll be impressed, because that means you've done very well with that learning curve. Doing a rexes is not an easy skill. We have to all learn it. Very nicely done. I like the pivoting in the incision. That is just fantastic. Looks great. Looks like about maybe 5 millimeter rexes. Pretty good. I like it. Now let's see the hydro dissection. Releasing a little viscoelastic. Okay. And then let's see BSS going around. And there's a good fluid wave. Very nicely done. Tapping the center of the nucleus. I like that. The eye is not quite a primary. Look at the three lights on the cornea, the Purkinje image. See, it's not in the center. You want to be able to center that up a little bit better. At this point, it looks like this is the patient's right eye. I tell the patient, put your chin down. Maybe to the left eye. In that case, raise your chin. But I want those three dots, those Purkinje images, I want that in the center of the cornea, the whole case. I don't want it where it is now. You can still do the case, don't get me wrong, but it's just not as easy. Why suffer? So once you get two instruments in the eye, you can actually position the eye. Let's see. So a little bit of washing off here with the phaco probe. It looks like a chopper in the second hand. And there you go. Now the Purkinje images are more center. And now it looks like a groove down the middle. Let's watch this groove. Looks pretty good. Nicely done. Deeper in the center, shallow in the periphery. I like it. And yeah, okay, a little bit more. Now rotate. Let's see, 180 rotate. Good. Hopefully it's going to be like a stop and shop technique. By case 100, you shouldn't have to do divide and conquer. You should be able to do stop and shop. There you go. Nice split down the middle. Look at that. Very nice. I like the rotating too, by the way. And now let's see. Rotate again. Fully split. I think you have two solidly separated halves. And now let's see what we're going to do now. A chop. Let's see. And yes, very nicely done. Chop went through. Not fully propagated, but probably sufficient. There it is. Bring that piece up. Now it's separated, and here's another quadrant. Very nicely done. So see how now, as the surgeon is operating, the three Purkinje images, or the three light reflexes of the first Purkinje image, how they're centered in the cornea. That's what you want the whole case. So that looks good. Very, very good here. Second half of the nucleus, and another chop, almost. And, oh, careful. Now, at this point, I would not chop anymore. Just wolf it down. Just aspirate it down. You know what? I agree with you. Good job. And let's see, bringing the rest of that piece in. Probably pretty good phaco settings because there's good anterior chamber stability. I didn't see any bounce in the anterior segment. That looks great. Beautifully done. So nucleus removal, very nicely done. Very efficient. Beautiful. And now let's see what's going on here with the IA probe. Cortex removal. Again, keep those Purkinje images in the center. Looks great. A little radial movement. I like that. Going around here. Circumferential and then pull radial. Very good. All cleaned up pretty nicely. A little more on the subincisional. And then using this coaxial with a bent tip. Was that maybe a 45-degree tip or 90-degree tip? Able to get there in the subincisional space pretty easily. And that's pretty nicely cleaned up. Wow, fantastic job. So for case 100, you are doing a fantastic job. At this point, essentially my only criticism is keeping the eye in primary so that light reflex is right in the center. Let's see the lens going inside the eye. And here it goes. Looks like an acrylic lens, single piece, going in nice and easy. Good. Unfolding. Let's see, get that in the bag. And get that. Your fingers shouldn't be in the view either. So you got to do this without having your fingers block your view. Let's see the eye probe going inside the eye, taking out viscoelastic. Still a little smudgy stuff there, in the under the nasal spot there. So still, you need to go behind the lens to remove viscoelastic, and there's still a little bit of stuff there on the lens capsule. But hey, for case 100, you are doing an amazing job. Keep up the good work. Hey, don't hydrate the walls of the incision. Hydrate the roof. Come on, didn't I teach you? Oh, get that piece out. We'll get that out of the eye. Wash it out. Very good case. I have such good faith in you. You have done a beautiful job. I hope you recognize your case and have some pride in the work that you're doing. And you know what? I'd love to see a video from you at case 500 or case 1,000. You will do beautifully. So congratulations, job well done. Just please don't hydrate the walls of the incision. Do it my way. Come on now. All right, thanks for watching, guys.